Alright, today we're going to be talking about the maxillary artery, which is one of the terminal branches of the external carotid artery, which is seen right here. It traverses the infratemporal fossa and it gives off many branches while it's there. It gives off the inferior alveolar branch here, which courses through the mandibular foramen and terminates as the mental artery, which is not shown. It gives off two branches to the ear, the deep auricular and the anterior tympanic branch here and here. And then it gives off the middle meningeal artery here, which enters the skull via the foramen spinosum. And it gives off the inconsistent accessory meningeal artery, which is shown here, which enters the skull through the foramen ovale. It continues along here and traverses the lateral pterygoid muscle, which is indicated by these green lines here and here. And then it gives off muscular branches to the temporalis muscle, so these deep temporal branches, gives off a branch to the pterygoid muscles, which is this pterygoid branch, and it gives off a branch to the buccinator, which is this buccal branch. Then it continues along and it gives off the posterior superior alveolar arteries, which supply the teeth of the maxilla posteriorly. And it gives off the infraorbital artery, which enters the inferior orbital fissure and continues along and gives off the middle and anterior superior alveolar arteries here, which supply the maxillary teeth anteriorly. Then it enters the pterygomaxillary fissure, which is shown here, and it gives off the descending palatine artery, which branches into the greater palatine and lesser palatine arteries. And it also gives off the sphenopalatine artery, which then gives off the lateral posterior nasal arteries and the posterior septal branches of the sphenopalatine artery. And that is the maxillary artery and its major branches in the infratemporal and pterygopalatine fossae. Thanks for watching.